Assalamualaikum. I'm Dr. Sindhu, one of treating doctor here at this clinic. May I confirm your name and age, please? Nice to meet you, Mr. Abdullah. What brings you here today? Okay. Oh, I'm really sorry to hear about it. It must be very stressful for you, Mr. Abdullah. Is there anything you want to add? Okay, Mr. Abdullah, to come to the diagnosis, I'll ask you a few questions regarding your condition. Is it okay with you? Okay, so Mr. Abdullah, is a fever high grade? If it is associated with shivering and chills? Do you have any cough? Okay, yes. If it is productive or dry? Okay, it's productive. Okay, and can you tell me the color of the sputum? Okay, it's rusty color. Okay, do you have any difficulty in breathing? Okay, and if there is any chest pain while breathing, or chest pain would increase with breathing or coughing? No? Okay. Okay, and so Mr. Abdullah, are you undergoing any condition which need radiation or any sudden chest pain with breathlessness and fever? Okay, if you recently been exposed to chemical inhalation? No? Okay, good. Okay, do you have any contact with ill person at home? If you visited a friend in hospital who had same symptoms as you have? Okay. Okay, so how about weight loss, Mr. Abdullah? Is there any significant weight loss? Do you have any sweats at night? If you notice any blood in the sputum? If you notice any bluish coloration of your finger and toes? No? Okay. If you had these symptoms, a similar condition in the past? Okay, that's great. Okay, so Mr. Abdullah, I'll ask you a few personal questions, okay? I think it is okay, if it's okay with you. Okay, so Mr. Abdullah, do you smoke? Okay, how much? Okay, 2 packs per day. And do you smoke? Do you drink? Okay, do you have any high blood sugars or blood pressure? Okay, and like to do some exercise? Is there any stress at the work? Okay. Okay, so Mr. Abdullah, how about your family? If there is any major medical problem in immediate family members? No? That's great, mashallah. Okay. Okay, so Mr. Abdullah, if you are taking any medicine regularly, prescribed or over the counter or herbal, do you have any allergies? Okay, so Mr. Abdullah, as you said that you feel breathlessness and you have high grade fever with chills and fever and body ache, and do you have a productive cough? Okay, and it is rusty colored, and you smoke and drink occasionally. Okay, so in order to confirm a diagnosis, I'll need to examine you. Okay, is it okay with you? Thank you, Mr. Abdullah, for allowing me to examine. Please come onto the couch and take your shirt off for me. Okay, so I'll start general physical examination and full respiratory examination. Okay, and I'll also check curb 65, CRB 65, because patient is in clinic. So if he's with the urea, then curb 65, and if a patient presents to the clinic without electrolytes, then CRB 65. Okay, so patient's age is 28, so 0. And regarding confusion, as patient is aware of everything, so confusion is nil. And now come to the examination. So physical examination, I'll start from the hands. I'll look at the fingers if there is any clubbing, cyanosis, or any hemorrhages, and then the fingers and the palm, if there is sweating or not, and the pulse, and then I'll check the blood pressure. Okay, and then from the and then I'll check the eyes and the tongue for cyanosis. Okay, and then I'll count the breathing. Okay, and breath rate per minute, and I'll check for if patient is using any accessory muscle, and then I'll palpation or expansion of chest if it is reduced or not, and then I'll ask patient to say 99 to check vocal fermenters and for vocal resonance, and percussion for the for the head consolidation, and then I'll auscultate for any bronchial breathing or not, if there is any bronchial breathing or not. Okay. So an examination, I have checked the general physical examination and full respiratory system examination, and I have also checked the CRB 65. Okay, so a patient's respiratory rate is more than 18. Okay, but there is no confusion. Blood pressure is normal, and he is 28 years. So only one is score. Okay, so I'll consider the treatment. Okay. So explanation. I'll come to the explanation. So, Mr. Abdullah, I'm very much concerned about your condition. Probably some bugs have entered your chest cavity and causing a condition which we call medical terminology pneumonia. Do you know anything about pneumonia? Okay, do not worry, Mr. Abdullah. I'm here to explain it to you. Okay. Actually, in pneumonia, it is the condition bugs damage layer of breathing channel, and from a cavity full of pus, and from a cavity full of pus, and this can cause pain, difficulty in breathing, and from here pus enters the blood stream to cause fever with rigor and chills. Okay, if it is clear to you. Okay, so Mr. Abdullah, in order to confirm my diagnosis, I'll offer certain set of investigations. Okay, is it okay with you? Okay, so it is a full blood count. Okay, and ESR and CRP. Okay, and chest X-ray. If and I'll maybe we'll need chest X-ray if symptoms will not resolve or diagnostic is uncertainty. Okay, and sputum and CS and acid phosphobacilli. And okay, so in future, okay, I hope you'll not need this. Okay, so let's come to the management. We'll divide the management into non-pharmacological and pharmacological. Okay, so so I will advise you. I'll strongly recommend you to take rest and drink plenty of water. Okay, and I'll encourage you to stop smoking because it is not good for your health. Okay, and take steam inhalation. Okay, and I'm going to prescribe you analgesia, that is paracetamol, 1 gram 4 times per day. Okay, and here is a clarithromycin 500 mg twice a day. Okay, one morning and one in the evening after a meal. Okay, and take it for 7 to 10 days. Okay, if you are with me. Okay, so Mr. Abdullah, I would like to review and reassess your condition in less than 48 hours. If it okay with you? Okay, so and Mr. Abdullah, if improving, then continue with the treatment. Otherwise, we may consider chest X-ray or admission in the hospital. Okay, is there anything else you like to ask me today? Okay, can you take a leaflet about your condition from the reception desk. Okay, it includes all the information regarding your condition. I hope it will be helpful for you. Can you further information from the internet and take you for your thank you for your cooperation. Okay, I wish you a speedy recovery. Goodbye.